Welcome back, everyone, to this afternoon's session in the theatre, which is going to focus on one of those absolutely central issues, something that matters to healthcare providers, to policymakers, and really to the public everywhere. It is antimicrobial resistance, the reduced effectiveness of drugs that are relied upon around the world, and it is today a major global public health threat. I'm sure, given this audience, most of you will already know that 700,000 people die every year because of this, and without effective interventions, it's thought that as many as 10 million people a year will die by 2050 because of antimicrobial resistant infections. So stopping this from happening is going to require a multi-sectoral response, healthcare, of course, but also conversations on sanitation, on hygiene, with the food industry, and indeed with the general public. And I'm delighted to welcome as chairs for this session Her Excellency Dr. Hanan Mohammed Al-Kuwari, and someone who has worked tirelessly to raise awareness of this particular issue, whether in her home country or internationally. So I'm going to hand over now to England's Chief Medical Officer, Dame Sally Davis. Sally.
Thank you, Michelle. So, thank you, Wish Forum, Dr. Hanan, Lord Darzi, for putting AMR, antimicrobial resistance, on the agenda. And how right it is, because this week is Antibiotic Awareness Week, World Antibiotic Awareness Week. So we should be talking about it. Let me introduce this starry panel. We all know Dr. Hanan, Her Excellency, who is the Minister of Public Health here and has already demonstrated her understanding of all these issues. Next, we have Dr. Ahmed Al-Mandari, the Regional Director for the Eastern Mediterranean region of the World Health Organization, followed by our colleague, the Deputy Health Minister of the Republic of Turkey, Professor Dr. Emine Alpmese, and then my dear friend, Dr. Shidi Moeti, the Regional Director for the WHO of Africa, the region there. So, to set the scene, Dr. Hanan has kindly agreed to tell us where we are.
Dear ministers, WHO regional directors, colleagues, ladies and gentlemen, dear friends, welcome to this briefing. Antimicrobial resistance has become one of the biggest threats to global health and endangers other major priorities, such as human development. Approximately 700,000 people die each year of communicable diseases due to the pathogens resistant to currently available drugs. All around the world, many common infections are becoming resistant to the antimicrobial medicines used to treat them, resulting in longer illnesses and more deaths. Antibiotics are overused and misused, both in people and in animals, and often given without professional oversight. This inappropriate behavior is accelerated by contemporary trends, such as internet sales of antibiotics that in many countries allows individuals and farmers to escape regulations put in place to prevent and limit abuse. At the same time, not enough new antimicrobial drugs, especially antibiotics, are being developed to replace older and increasingly ineffective ones. Antimicrobial resistant microbes spread easily beyond hospitals and health facilities. Poor infection control, inadequate sanitary conditions, inappropriate food handling encourage the spread of antimicrobial resistance. They are found in people, animals, food, and the environment, in water, soil, and air. They can move long distances through migrant birds, for instance, or facilitated by the growing phenomenon of medical tourism for surgical procedures. Global environmental changes, such as the increase and intensity of flooding events due to climate change, may further accelerate circulation in the environment and exposure of people to resistant bugs. If extensive action is not taken at all levels, we may become unable in the near future to treat common infections, thus reversing the progressive decline of communicable disease incidence and mortality that we have seen over the last century and up to now. It has been estimated that in 2050, AMR may kill 10 million people in the world, more than cancer and diabetes. We could pass from 1 death at any 10 minutes due to infection resistance to antibiotics to 1 death any 3 seconds, a development that none of us wants to see. The good news is that awareness of the seriousness of this problem has been emerging at the international and national levels. Global leaders met at the United Nations Global General Assembly in New York in September 2016 to commit to fighting antimicrobial resistance together and agreed on sustainable multi-sectorial approaches to addressing it. A WHO global action on antimicrobial resistance has been approved by member states, which, in addition to actions aiming at improving awareness and knowledge, stresses the need to optimize the use of antimicrobial agents and develop the economic case for increasing investment in new medicines, diagnostics, tools, and vaccines. Indeed, it has been estimated that without effective action, in 2050, AMR may cause a drop of 3.5% in global GDP. Several countries have acted on AMR through national action plans. In Qatar, we have developed such a plan for 2018-2022 within the framework of the National Health Strategy, and we are implementing a number of activities ranging from awareness raising to surveillance and involvement of other sectors. Ladies and gentlemen, dear colleagues, AMR is a very serious threat that we need to continue to take very seriously. We do not miss political commitments and international agreements, both at the national and global levels, but we need strong and consistent leadership to keep this issue high in the agenda and pursue the implementation and enforcement at all levels of the decisions taken, guided by political coherence throughout government action. In the health sector, we must continue to contrast inappropriate prescribing and dispensing of antimicrobials leading to misuse and overuse. Health workers need to be given up-to-date information, be able to identify the type of infection, resist to pressures to prescribe antibiotic, or benefit financially from the supplying of medicine. We need to ensure hygiene and infection prevention and control practices in hospitals to prevent the spread of drug-resistant infections. A report just recently published by OECD points out that 3 out of 4 deaths from the superbug infections could be averted by spending just as little as $2 per person a year on measures as simple as hand washing and more prudent prescribing of antibiotics. Such a short-term investment to stem the superbug tide would save lives and money in the long run. And within a consistent One Health approach, we need to work with other sectors, such as animal farming, aiming at promoting sustainable food and agricultural systems with improved hygiene to prevent infections and reduce the spread of antimicrobial resistance. Think globally and act locally. Once again, this principle should guide our collective action with confidence in our capacity to address an issue that no single country or single institution can manage and solve in isolation. Thank you very much.
Thank you, Dr. Hanan. So it's after lunch, you're all dropping off to sleep, and you haven't thought how important this is. So I want you to stand up if you've had antibiotics in the last 2 years. Right. Now, if the English data holds true across the country, then 1 in 4 of you didn't need that antibiotic. Sit down, hang on, if you've had a flu vaccination. because flu vaccines, along with many other vaccines, save antibiotics. Okay, still some standing. My flu vaccine wasn't there when I went to get it, so I am getting it, I promise you. You can sit down if you had an infection, but stay standing up if you had that antibiotic for prevention. So we still have a few colleagues standing, but not many, because this is a health meeting. Thank you. Do all sit down, having woken up. We need these antibiotics to work, and we're hearing a lot about this epidemiological transformation and non-communicable diseases. But what are people going to die of? Well, you might die of cancer, but you're much more likely to die of infection. And we want functioning antibiotics and other antimicrobials. You may die of a complication of diabetes, but you're pretty likely to get infections. We need to look after these antibiotics. We need more. We need to do things about it. So don't hide from this problem behind the NCDs. The NCDs will bring the need for antibiotics crashing upwards like a tsunami, and we need to be able to respond. So I'm going to start by asking our other three panel members a short question to get us going. Then I'm going to turn to all of you to ask questions. And of course, those of you I know that should be asking questions, if you don't, I'll ask you a question. So you're not going to sleep, you're going to join in. But as you join in, I want you to think about what you're already doing. Because I bet when you examine your practice, whether it's policy, whether it's delivery of healthcare, whether it's frontline healthcare, you're already doing things that can make a difference. So I want you to recognize that you're making a difference and then build on that. So let me turn first to Dr. Ahmed, now the new regional director for the Eastern Mediterranean. You've got a comprehensive view of the challenges of your region. And where does AMR rank in your list of priorities, and what progress are you making?
Thank you very much, Sally, and I'm pleased to be here in this panel. In fact, before answering that question, I'd like just to go back to the resolutions that have been produced by United Nations General Assembly, by the WHO during its meetings, and also by the regional committee here, the meetings we have had in the past. It has really, this sort of AMR topic gained a lot of political commitment and attention by all of these, resolutions. At the same time, it is considered as one of the flagship programs. If we talk about, the general program of work, number 13, which is calling for the 3 billion to be healthy people. So it is one of the major programs. Here in our region, we have made our, new vision, 2023, which is health for all, by all, based on the work that have been done by my colleagues in the past, developing a very strong evidence-based framework, for AMR that has been shared and supported by member states during the previous regional committee meetings, and also the last regional committee meeting we have had in Khartoum in Sudan. So based on that support, my colleagues, the experts and the technical departments, they have created that sort of program, the way how to help and support countries. Either, as you have just mentioned, developing the awareness of the communities and also the healthcare professionals with regard to the use of antibiotic, involving other sectors, multi-sectorial, like, Ministry of Agriculture, regarding the use of antibiotics for animals and also, in some poultry industries. At the same time, developing the capacities of the healthcare professionals by running technical workshops, that will equip our colleagues working in the front line with the knowledge and skill how to use antibiotic in a very safe manner that will not harm, but at the same time it will help and raise and remove the suffering of the people from infections. Yeah.
Good. Thank you. So, action in the Middle East. Emine, you're an infectious diseases specialist as well as a health minister. What a fantastic combination. So what are the key policy levers that you think we can use to combat drug resistance? And how can we get the other sectors to join in?
Thank you very much. Before proceeding with my remarks, I would like to express my satisfaction for visiting Qatar and extend my deepest gratitude to the State of Qatar and Qatar Foundation and my esteemed colleagues for hosting us in Doha in the most hospitable way. It's my heartfelt wish that this meeting should be extremely productive for us all and constitute a timely boost for the solution of these global health problems. We are all aware that antimicrobial resistance is one of the most serious health threats in our time. And this threat has impacts on treatment success, leads to high mortality, creates long and severe disease processes, reduces labor productivity, shortens life expectancy, endangers food safety, drives up treatment costs, and poses many other risks. The multi-sectoral and transboundary nature of the problem entails intersectoral and international collaboration, and outcome-oriented national and global action plans drafted with One Health approach and comprising other sectors such as agriculture, environment, and food will be the tools that will pave the way for success. And misguided and inappropriate use of antibiotics is certainly the primary trigger for the AMR. And another factor that poses a threat to us all is the slowdown in the production of antibiotics and invention of active drug ingredients. The declining profit margins in the market and insufficient incentives impact the development of antibiotics production and development of new agents. And in this area, we must more discuss for prevention. And also, I'm an infectious disease professor, and I had my PhD in infection control in hospitals for the prevention of antimicrobial resistance. I believe that our action plans for combating it should not overlook such efforts as the effective use of early diagnosis kits, hygiene and infection control campaigns, and programs for boosting vaccination rates. And we, as the Republic of Turkey, have launched necessary efforts geared towards solution, put into force our national action plan, and we continue to implement it closely. In addition, we have adopted a national action plan on rational drug use to prevent unnecessary use of antibiotics. The action plan has 99 actions, including each stakeholder as physicians, pharmacists, pharmaceutical industry, and allied health person. I would like to give some examples from this campaign. We distribute rapid antigen tests to family physicians, especially for upper tract infections, respiratory infections, because most of the unnecessary use is in viral infections, viral respiratory infections. We have an e-prescription system in our country, and with the help of this, we could monitor our physicians' prescriptions and give feedbacks to the physicians. And we make public awareness campaigns, especially to explain the risks of self-medication and the importance of rational use of antibiotics. We have a big team from all provinces work on rational use of medicines to organize training programs for healthcare professionals. And also we are a member of WHO Antimicrobial Consumption Network, and we share our antimicrobial antibiotic consumption data and attend the annual meetings of this network. And we have a pharmaceutical track and trace system which enables to define the locations of products in the supply and distribution channel. It's possible with the help of the electronic product code to track each transaction of the drugs in the supply chain and beginning from the production or importation. And we have thus managed to attain a 17% decrease in antibiotic sales in 1 year. And we assess the prescriptions according to the parameter of percentage of prescriptions containing antibiotics. And thus the rate of prescriptions containing antibiotics has decreased from 35% in 2011 to 30% in 2016. And we thank to these all efforts. And I would like to emphasize that global initiatives are as important as national policies in combating AMR. And we are working closely with WHO European Office and conducting a surveillance system study. Furthermore, a side event on antimicrobial resistance with Sweden, the United Kingdom, and the Netherlands was organized at the margin of 67th World Health Assembly to ensure that work carried out in our country could be transferred to international stakeholders. On the other hand, we were the co-sponsor decisions made about the issue in the World Health Assembly. In addition, AMR was also referred in the final declaration adopted at the Leaders' Summit held in Antalya during the G20 presidency of our country, and we are supporting the Global AMR Hub project or G20. And before concluding my words, I would like to express that besides that sectoral cooperation at domestic level, we should also organize inspiring events for other countries through global cooperation projects based on One Health approach. Thank you very much.
Thank you, Emine. So, Shidi, Africa has many challenges combating AMR, but I wonder if you'd talk to the medicines regulatory capacity and the surveillance issues, what steps you're taking with the countries in the region to address them.
Okay, thank you very much, Sally. Before I start, I'd also like to thank the organizers at WISH for having invited me to the meeting and also to join this panel on this very important subject. The awareness of the importance of antimicrobial resistance in the African region among the governments, the ministers, has increased. And my colleague, Dr. Ahmed, already referred to some of the events at the global level, at the regional level, including a discussion at our regional committee as well. That's made ministers of health aware that this is something that needs them to take action. So some of the challenges that our countries faced, I'd like to start first of all by saying, we know that in many African countries, much of the population doesn't have access to health insurance. So there is a big market for low-cost, cheap drugs. And one of the big problems and contributors to this is falsified, substandard drugs, including antibiotics, that are circulating within the region. There is a distinct market, sometimes very informally, literally on street corners, corner shops, markets for this type of drug. I was speaking recently to a head of state who had decided to take action against falsified medicines and clear them from the markets. And he told me there was an outcry in the population and people were asking him, so where are you expecting us to buy our medicines? You are cleaning literally the markets where you buy fruit, vegetables as well, apparently, as medicines, of the medicines that we can afford. What do you expect us to do? Which I guess speaks to the need then for people to have access to health insurance so that when the doctors are prescribing the medicines appropriately, they can be affordable for the population. This is one particular issue in our region. As regards the regulatory systems and surveillance in the region. We've been working in WHO in the region for about 10 years now with the national regulatory authorities through initially our immunization program and also our essential medicines program in our health systems cluster. And we've been working with them to try and help to build their capacity to network their technical as well as other resources, and to help them use the same tools, to exchange tools, because we recognize that one of the big challenges that they face is simply having sufficient resources, funding, staff of the relevant capacities, skills, range of skills, in order to be able to carry out their role effectively in regulating the procurement and the use, prescription, and the quality of medicines, including antibiotics, to address this issue. The role of these regulatory authorities has expanded and increased of late, but we see there's a lag in the regulations that govern them, the legislation that governs how they work, the adaptation of policies and guidelines to international standards to be able to be up to some of the issues that they have to address, including the importation, the prescription, the quality of the antibiotics that are used in the countries. So it's clearly an area that needs a great deal of investment, the capacity itself of the national regulatory authorities. AMR, it's already been said a couple of times, is an issue that requires action across sectors. So not only do these regulatory bodies within the health sector need to work, but we also need to work with the animal health, livestock, agricultural sectors. In most of our countries, the mechanisms that enable this dialogue, influencing each other's policy, monitoring together what is happening, are not yet in the shape that they can effectively work to inspire or indicate the types of actions that need to be taken by different sectors. So these are other areas that need to be worked on. And then the capacity for quality assurance, including the laboratory capacity to carry out tests, is still very much of an issue, a gap in our countries. As far as surveillance is concerned, we know that the AMR data available in the countries is very much a challenge. 40% of our countries don't have recent data on AMR, mainly because we do not have the laboratory capacity, the staff, the expertise, the equipment, the supplies, in short, again, the resources to enable the country to carry out this type of testing that they need to do. And the methodologies that they are using also need to be standardized so that they are able to be up to international standards, and we're also able to use them to make comparisons between countries. So it's very much a matter of resourcing, regulations, guidelines, work across the sectors for countries to have, for the NRAs to have the capacity to play their role in putting a stop to at least influencing the emergence of AMR in the region.
Thank you. So you've brought in the issues of access, which are both getting hold of the drugs and then the quality. We had a bit earlier some discussion about the supply chain. I thought it was wonderful how, Emine, you highlighted how when a country really wants to, you can reduce antibiotic use. 5% over 5 years, a percentage point each year, as populations grow and illness gets more complex, is an achievement. And of course, we saw your great national action plan and the examples here in the Middle East. So I'm now going to turn to all of you. Who would like to ask a question? Is anyone going to ask a question? Yes, I can see my former minister. Well, he wasn't actually mine, he was someone else's. Stephen Dorrell, number 4, if you can pass it to him, please. It's quite difficult to see people, and then we'll come to the front there with number 1. Yeah?
Thank you. Stephen Dorrell. I now chair the NHS Confederation in London. I think this is an extremely welcome session in this conference, and I think it reflects very well, if I may say so, Sally, on your achievement in having raised the profile of this issue since you've been Chief Medical Officer of England. But what I want to do is to try to be a little bit more ambitious. Instead of just analysing the problem and working out what might make things a bit better, is to pick up the parallel you drew at the beginning with climate change. We started to make a difference on climate change, not by having G7 leaders putting it onto an item on their agenda, but by having a convention where virtually all the countries of the world signed up to a plan of action to make a difference to climate change, which is something which all humanity shares an interest in. Seems to me AMR is exactly a similar case, and should we not be aiming to achieve that in this very important area? Added to that, it'd give Donald Trump something else he could withdraw from.
Hurrah! I mean, to the idea, not to Donald Trump. So, hands up those who think we need a conference of the parties moving to a treaty on AMR. It's not everyone's hands yet. That's the problem, Stephen. We've still got a bit of a way to go. I'll let my colleagues talk to it a bit, but we had number one over there, the lady in cream.
Thank you. Thank you. I'm Dr. Amer Ben Said. I come from Tunisia. I'm the Director of Primary Health Care in the Ministry of Health. I would like to thank all our speakers. It was very interesting to hear you. And I have a question to our speaker from Turkey. If I understood, you said that you have a surveillance system to track a doctor prescription in terms of antibiotics. What is the impact of this surveillance system, and when you detect an increase of antibiotic prescriptions, what do you do? Thank you.
We call the doctor. What are the reasons for these prescriptions? And when we detect if as a doctor or doctors have more prescriptions on antibiotics, we have a training program for them. For example, 10 or 5 or 10 doctors, we call them and we go to the city and we have a training program for them, and we have training program about rational use of antibiotics, and it's only the training program. We don't have any prohibition for this. We cannot say don't write the antibiotics, but we ask why are you prescribing these antibiotics? This is the rational antibiotic use rules, and we have a 1 or 2 days or 1 week training program for these doctors. We can see who is prescribing these antibiotics from the system.
That's great. We tried, me as Chief Medical Officer, writing to a randomized half of the top 25% prescribers of in general practice. And doctors are competitive. You and I know that. Our colleagues will have seen it. And they dropped their prescribing, and that drop lasted over a year. So behavior, whether it's through training or showing them data, can really make a difference. More questions? There's a lady in green there, number 1 going to it, and who would come afterwards? A gentleman there who I think I recognize, which will be number 4, but it's difficult in the dim light. Yep.
Hi, my name is Abba Saxena. I was formerly with the World Health Organization in the area of ethics. The question is actually something you already raised, this issue about behavioral changes for physicians and physician prescribing. But what about behavior change and trying to affect the behavior of patient population? Because I think a lot of this antibiotic use is driven not so much by physicians, but also by the population asking to get antibiotics.
Thank you. Shall we take the other question and then come back to the panel? Yep, number whichever.
4. So I'm Jonathan Weaver from Imperial College in London, and I'm an infectious disease physician by background. So I have a sort of technical question about it. So I think antimicrobial resistance is inevitable, as first noted by Fleming in 1942. And so we need to think about the pipeline for new development. And I'm concerned that as there's been no new class of antibiotic for 30 years, it may take a very long time before any new classes of antibiotics are available. So I'm going to ask for an expansion of research into vaccination as an approach for antimicrobial resistance, and to use immunization against resistant bacteria as being a way forward. I think the technology is improving around developing new vaccines, and I think there could be an opportunity to release perhaps some of the regulation around early vaccine studies, such that there can be a really great expansion of attempts to make these sorts of antimicrobial vaccines, which could enter into use very much more quickly than we'll ever achieve through new chemical entities. So it's a challenge for the CMO.
That was not a question, Jonathan. So who would like to, but very worthwhile. Number 2, have you got someone down here at the front? Nope, nope. Yeah, that'll do, fine. Who's got a microphone? No, you'll have to sit down and we'll give you one in a minute. There's a lady, no, a gentleman.
Yeah, good afternoon.
God, gender fluidity on the platform.
I'm a medical graduate. I come from Sudan. And as we all know that microbes know no boundaries and no borders. They don't need a passport. And not so many people know that, but in Sudan, if you need antibiotic, you don't really need prescription. It's sold over the counter. So I would like to ask if there are any efforts for collaborations between countries and any regulations that has to be put forth from the region and internationally. Thank you.
Thank you. So which of you would like to address vaccines and regulation, over-the-counter, and the role of patients in all of this? Lovely. Ahmed.
Thank you, Sally. I mean, just answering the question, asked by last participant. There are regulations, and WHO is calling all member states to implement, the control of antibiotic use. And over-the-counter prescription is one of the challenges we are facing here, and I'm sure many other countries are facing the similar challenge. Now it comes the duty of the country itself to implement that sort of rule and regulation and, control it. As you said, it has been mentioned in some countries, in fact, as a patient, I can go to the pharmacy, ask the pharmacist, give me whatever antibiotic I was recommended by my colleagues, or I came across the internet, for example. I may ask any antibiotic and it will be given to me like paracetamol or any other medication. And that is the risk of it. And that is one of the challenges we are facing here, to convince regulators and decision makers, no, we have to stop it. Some countries have done it. We are having 5 countries who have made their action plan to work on AMR. Another 5 countries, they have made the policy and the action plan. It is just pending the official approval of it. 7 countries are, on the way of developing it. They have not yet developed. So we are trying to cover all the countries here in the region to have their, say on the use of antibiotics. If you allow me just to also talk about, changing the behavior. Changing the behavior is one of the difficult challenges when it comes into directing people to the right behavior. It is not only for people in the, not only the citizens, our colleagues, our healthcare, we are as healthcare providers also, we need to change our behavior. As it has been mentioned, many of the times, we see a child with a common cold, it is viral, but we prescribe them antibiotics. We see, young lady coming, say, for example, with maybe dysuria, because of one reason or another, we jump into antibiotic. Doing it that way, we are damaging the right behavior of the patients. We are telling them, whenever you come to me with a fever and runny nose, I will give you antibiotic. Later on, it will be difficult for me as a physician, if I want to adhere to the right rules and regulations when it comes into prescribing antibiotic, to convince that patient that I'm giving you the right treatment. She or he will leave me dissatisfied because I'm not giving him or her antibiotic. So this is another challenge that we have really to change our behavior first as physicians and as healthcare providers, then later on go to patients. Because the moment you come across a patient insisting for antibiotic, and I've been practicing myself, most of the time they'll be convinced if we tell them, no, you don't need it. But if it has been given by a previous physician, And instead of having 3 days of suffering, it will come into 2 days of fever and these things. It will be difficult. So we have to change our behavior as healthcare provider first before going to the patients.
I absolutely agree, but we did also some interesting focus groups in England, and we found that there are patients like you're talking about, and then there are quite a lot who actually go to the doctor, and what they want is their illness to be validated, to be told, yes, you're right, you're ill. And we discovered that if we gave them a prescription which said you are ill, and it's a respiratory infection, and it's probably viral, and this is how you look after yourself, the doctor signed it, tore it off and gave it to them, it worked. So we have to do the education in many ways, don't we? Very interesting. Anyone want to come in? Shidi.
Yes, I'm interested in saying something about the possibility for collaboration between countries and the fact that, as you said, these bugs don't know any borders. And also the suggestion that I guess we've agreed that a convention would be a good thing. As far as that's concerned, we have a lot to learn from the implementation of the international health regulations, I think, where member states are being asked to be responsible for stopping the international spread of disease, since this is a collective problem that globally will face all of us, and each of the countries have to play their role in controlling and managing and limiting this within their own borders. I think that the work that's being done, cross-border work, exchange of information, collaboration, exchange and sharing of tools and approaches around the control of outbreaks and infections of that sort could really inform what we do in cross-border work on AMR. We have countries already exchanging information about when there is an outbreak, about contacts, movement of people, potential for that to spread into other countries, territories. As I said, because we work with countries across borders as WHO, we're able to enable them to share tools. We can help countries to understand also the situation of your neighbor. If the type of surveillance systems that we're talking about in Turkey and other countries are available, this information can be made available internationally so that you actually have an idea what's happening in your neighbor and what sort of risk you run by being next to them and be able to influence each other. I do believe that the idea of having an agreement at the international level of mutual responsibility to take action, the various types of actions that have been described here, to limit the problem within our own borders is a very good one, and it could be powerful. And as I said, we're learning a lot about how this works and some of the challenges we have to overcome in relation to the international spread of outbreaks. And there are some challenges in countries and governments deciding to come out openly, take their own responsibility. I think there's a lot to learn there that could be useful in this case. Thank you.
Thank you. So what you're hearing is increasingly that the WHO and many countries are including AMR in health security, in planning like for pandemics and everything, and putting all of this together. So there was a gentleman over here, number 1, please. And then we'll go back there to someone with number 2.
Yes, first of all, I would like to thank to the Qatar government to have invited me to come here. I'm in Geneva, and I'm the president of the diplomatic circle, but I'm working for Merck Foundation, pharmaceutical. And Madam, from the WHO, you know that we are fighting against counterfeit medicament. I would like to say a few words about that. If somebody is investing $1 in counterfeit cigarettes, the profit is $10. If somebody invests $1 in cocaine or drug traffic, the profit is $100. And if he's investing $1 in counterfeit medicament, the profit is $1,000. So this is something that we have to fix on the screen every day, every day. There's one country who has made the law against counterfeit medicament. 2nd of April this year, it is Egypt. The penalty is 10-year prison. So please follow this country. And I'm sure that everybody is ready to accept a law as long nobody from the family is dying about this disaster. Thank you very much.
Thank you. Infection prevention and control, terribly important. Number 2 up there, please.
Hello. So I'm Dr. Nouf Al-Siddiqui. I'm a consultant dermatologist in Hamad Medical Corporation. I'm still prescribing lots of antibiotics. The question is, we have a partnership, a good partnership with the private sector. But unfortunately, the patients who are not satisfied, they don't get what they want from those antibiotics, will go to the privates. What kind of actions would you advise us physicians to take if those privates are continuing to prescribe those antibiotics without any restriction or concern to the patients? Complications that can occur in future. Thank you.
Emine, while you think about that, I'm going to ask the gentleman right at the back, number 3. Right at the back, there's a gentleman, if you could. We'll get the other one later.
Assalamu alaikum wa rahmatullah. I'm not in the healthcare profession. I am actually a pilot, but I do have a very severe interest in antimicrobial resistance. I think you have a very complicated message to convey to people, because the reality of it is, I have a friend who came out of surgery, I'll use this as an example, who's prescribed supplements, antimicrobials, and he was given anti-inflammatories and pain management medication. Rather than asking the doctor what each thing was prescribed for, he decided not to take anything, which was a very odd choice. However, with the rise of fake news and the rise of social media, people can be very cynical, and it's a very challenging message to get across. What's the right amount of medication? And people might associate supplements and superfluous prescriptions of supplements with antibiotics and anti-inflammatories, which they probably need, and then assume, well, all doctors over-medicate. And there's still a challenge in a lot of the developing world, if it's still fair to call them that some people refuse conventional therapies. And if they go immediately from refusing conventional therapies to being completely cynical towards necessary medical procedures, necessary medications, how can you as healthcare providers face that challenge of delivering an effective message?
Thank you. So the question of supplements, let me just say, unless you're deficient of something, you don't need a supplement, and if you take it generally, you put it out in your urine, you wee it out. Let's forget supplements. However, what you've both brought up is something very important to our health systems, which is how do we handle what I would call the rogue prescribers? They are giving patients what they think the patient wants, and it's often the private sector, and then you get patients doing kind of doctor shopping. You're not giving me what I want, I'm going to the doctor down the road, he'll get paid for seeing me and he'll give me antibiotics. We have a bit of that, but much less than many other countries. Do you want to come in? Thank you, Dr. Hannan.
Well, thank you very much for this very good question. And I think the answers lie in systems like what they have in Turkey around tracking medicine and tracking the prescription of medicine. So, Dr. Nouf, you'd be happy to know that we're actually in the process of setting up a system to track medicine across the whole sector. So the Ministry of Public Health Pharmacy is now doing that, and we will be very soon able to us also see where and who is prescribing what, and then be able to influence. I also hear a lot around the voice of the patient and the education of the patient. I do believe we really need to invest time in educating the patient, but that needs to happen after we've educated the clinicians on how to do that. But the voice of the patient and the power of the patient to choose is very important, and we need to educate our patient. But as you're speaking about patients, education, and the power of patients, I'm thinking of consumers and food. So that's where the patient's voice, I think, can make a bigger, or the person's voice can make a bigger difference. a lot of food and farming uses antibiotics. And that's where, as a consumer, by understanding this, the consumer can make a difference, because business responds to sales. And if the consumer chooses the organic, the well-farmed food, then we will see a movement away from antibiotics. And we here in Qatar, we're using the opportunity of the siege. So with the siege, we have been forced to look at our own farming and promote our own farming and our own local industry. And the type of farming that we're seeing emerging, because of the strength of the Ministry of Health, the Ministry of Commerce, in communicating the importance of avoiding antibiotics as much as possible and pesticide, is we're seeing a rise in demand in organic food. And a lot of the local farmers are producing organic food, which is something that we would love to see much more across the world, and which needs to become more affordable.
Thank you, and that's really important. In America, they've had chain reaction that grades fast food outlets by the use of antibiotics in the food chain and the food production. I've been working with investors in the City of London so that they can look at social investing very carefully. And I don't know how many of you have eaten the wonderful dates you get here in Kuwait. They are fantastic. Did you know that some of the Saudi date palms, they inject with antibiotics to make them grow big and supposedly healthy? So I'd stick to Qatari ones.
I just wanted to add a comment about the issue of patients and the private sector. I agree with you that it is a challenge. Our colleagues working at the private sector sometimes misdirecting patients' behavior towards the negative side. But also based on my personal experience and many of my colleagues' experience also as a family physician and on the literature itself, one of the weapons to avoid that sort of negative direction is strengthening our rapport and building a very strong trust with patients. The moment I have a strong respect and trust with the patient, definitely they will be convinced, to avoid any sort of medications that themselves they'll feel, no, it is not going to help me. And one of these is antibiotics. I have many patients coming from a private doctors to my clinic with a list of things to be done, including, say, MRI or angiograms or antibiotics, just like I am just sitting there as a worker for the private physician. But spending 15 minutes, as you have said, Your Excellency, with the patient, or maybe less than 15 minutes, he or she will leave the room very convinced, and definitely it will have an impact on the rest of the family members, because he or she got the information based on trust and respect. So we have to work hard on that, developing rapport with patients and their families.
Great. Emine.
Also in Turkey, we have a great media campaign for the antibiotics, for the rational use of antibiotics, especially for viral disease, not using in viral diseases, in respiratory tract infections. Also, our academicians are giving a report for the journals about the rational use of antibiotics, and this is good for public trust to you. For rational use of antibiotics. Also, the rapid diagnostic kits are very good for the patients to believe that they don't need the antibiotics. And this is these two training program, rapid use of rapid diagnostic tests and media campaign is very good for the rational use of antibiotics.
Great. So number 3, you get your chance at the back. Then we'll come down to number 5.
Clemens Budde from Berlin, Germany. So what about the use of antibiotics in animals and veterinary medicine? As pointed out by just a minute ago, I think the more antibiotics are prescribed in animals than in humans. So what to do about this problem?
Thank you. The 70% of antibiotics that go into animals, 70% of which is for growth promotion. We were coming down to number 5 here. And then...
Thank you very much. First, I think Ara Darzi and his team put a wonderful document together. I much enjoyed reading it. The previous speaker, we are clearly in the same line. My name is Ok Pannenborg. I'm retired now. I used to be the Technical Health Director and Chief Health Scientist at the World Bank. I want to ask you the following, Sally, and the panel. I think on antibiotics and antimicrobial resistance, the world has made great progress. Over the last 10 years, I think actually where we are now is amazing. However, I feel that the next step in progress is kind of stalling. And it has to do with the item of engaging the private sector and industry, particularly livestock and meat industry. It's wonderful that we have the panel all from the public sector, seemingly, all from one way or another government. So my question would be, how do we take the next step towards the private sector, and not just generally the private sector, not only OIE and the private relationships, private sector relationship with FAO and WFP, etc., and the UN system, or that governments have, but very specifically with meat industry, all kind of industry, even agricultural industry, that use those antibiotics that are larger than what we use.
I've got you. You're right, except you're wrong. We are not in an amazingly good place. We're in an amazingly bad place. We have just begun to get awareness, so I disagree. And we do have a problem where human health here, and what you're bringing up is the One Health. The bit you've both forgotten is, of course, the environment. Animals, including humans, peeing out 70% of antibiotics. People in primary care disposing of unused antibiotics. Runoff from farms, from fish farming, going straight into the water table. So, a big problem. Shidi, what are we going to do about it? You're probably going to tell me I've got to sort it as the IACG, but...
Yeah. Well, we're already doing something about it at the international level in our One Health work with the FAO, or at least in getting them to work in their sector to try and influence the policies that go on in that sector in countries. I think the issue of the private sector, the industry, will need to be dealt with. I mean, there are clearly multinational industry that can be dealt with at that level, which move meat products all over the world. That can be one way of doing it. And then what you're talking about in individual countries, at the end, has to be the collective effort of all of us through the governments, I believe. I mean, that's what we mean by the regulatory function of Ministry of whatever, livestock, agriculture, with the industry, with the farming, and this type of monitoring that's being discussed here, and I guess trying to impose some sort of standards in agreement, because whatever it is that the industry is investing in for their own gain, at the end of the day was going to be paid from, in terms of impact, from public resources, from the impact on people's health and the problem of antimicrobial resistance globally. So I don't have a brilliant idea now. I guess in the audience we could come to how to have an influence on the private sector, on the private for-profit industries that work at the international level, that work at the national level, and impose some sort of rules and regulations for the common good by the governments.
So that's back to Stephen Dorrell's point, and to get there we need consumers, we need investors, we need understanding of the public, and everything to take the member states. And actually, of course, that's why the member states took AMR and One Health to the UN General Assembly. That was exactly why this One Health area. Let's get a couple more questions as the last questions. There's one at number 6. And you've got one at number 1, have you? Yep. Number 6, please.
Thank you very much. That's very amazing meeting here. My name is Kao Amin. I'm a consultant geriatrician. And also I sometimes utilize my leaves to go to refugee camps, especially in the Kurdistan region of Iraq. I work there and there's lack of sanitation, lack of structure, vaccination program, and more worrying is inappropriate antibiotic using because it's completely based on your assumption as there's no investigation tool. Those people with antibiotic resistance, some of them, eventually they will reach a new country. And that will be a globally, if not regionally, risk. What's the solution here? I really don't know. And what's the support of Qatar or Turkey in these refugee camps? Thank you.
Thank you. And a very quick question down here from number 1, but it's going to be quick. We're running out of time.
Thank you very much. Dr. Karen Cummings, Minister within the Ministry of Public Health, Guyana. Actually, I'm very happy that this topical issue was on the agenda. Indeed, it's a global threat, endangers the SDGs and a threat to survival of humans. Just to follow up on the One Health concept, well, it was partially answered, but I don't know if you want to add anything to that. The agriculture sector, environment, and public health. Is there, as we try to link the three, are there any challenges that you've encountered, especially in Turkey, as the One Health concept? Is there any challenges? How did you overcome the challenges, especially with the veterinarians, with the food, with the antibiotics to fatten the animals and so forth? So are there any challenges and how do you respond to those challenges?
Thank you.
And secondly...
We've run out of time, but thank you for that one. So what I'm going to do is give you each an opportunity, as we're in the last 2 minutes, to respond to that or to make some final comment, whatever suits you. Let's start with you, Shidi, and we'll work down. So,
yes, first of all, I think talking about the African region and the use of antibiotics in livestock and in agriculture, in a way, we still have a window of opportunity. It's not as widespread as it might be in other regions. So what we need to do is to learn from the experience of other countries how to control it, how to keep it low, how to reverse whatever has been started. I believe there is some, including in aquaculture, and to use that. And I very much support the idea of working within the region across countries and building very much on the work that we are doing on the international health regulations. The principles are very much the same, how to apply what we're learning there in this area, and then most importantly, how to improve the regulatory systems in countries so they do have an impact on the activities of the private sector. In our region, we hardly are able to get the private sector, private providers to comply with national rules and protocols for delivering services. So that's a huge additional effort that needs to be made. But I believe that with the level of awareness, the type of planning that's been done by countries, we are on the road to there. Thank you.
Thank you, Shidi. Always wonderful, but we're running out of time. Emine.
Till now, we have Omni program in our health system, in our hospitals, but now we have a national action plan, and in this plan we will have some collaboration with agriculture and the control of antibiotic use of veterinarians, but it will be in our future action plan.
Thank you, Emine. Ahmed.
Thank you. In fact, I don't have any accurate numbers about how serious the problem here in the region, but I must admit that, as Shidi mentioned, there is an area of, or window or opportunity for improvement. We have an issue here, and we need to work hard, to improve it.
Your Excellency.
Thank you. There was a question around the role of Qatar in refugee camps. So I invite you to go to the Innovation Hub. There's a booth for Qatar Fund, and it has all the activities of Qatar, and I invite you to have a look at that.
Thank you. So you've heard a lot this afternoon. There's a great report from the Leading Health Systems Network on outside on core standards for stewardship programs, which I recommend to you. Help us deliver what Stephen Dorrell suggested, a global agreement, which is One Health. And I ask each of you to go home and think, what are you going to do differently, not just in World Antibiotic Awareness Week, but this year? Thank you.
Thank you so much, Sally, and to all the panel. what you've outlined is, of course, sobering and frightening, but also very real and something that, you know, with every passing moment needs ever more urgent attention. So thank you very much for the way you discussed that and for all the contributions from the floor. I will also say that rather sadly for me, Sally, when the doctor does such a good job facilitating the discussion, then it leaves rather less hope for the journalists. So thank you for doing such a brilliant job.
Thank you.